Hello, my name is Omaima Al-layl. Now I will present my case and I will start with the patient information and chief complaint. 12 years old male was referred by his general dental practitioner with the crowding. The patient didn't like his crooked teeth. There was history of the trauma to the upper labial segment. So when we see the picture here, the patient in frontal plan at rest position and the facial form is ovoid, we can see the line become all around to his face. Then we have facial symmetry. The facial symmetry it is asymmetrical here because the chin and nose are slightly shifted to the right side. Then we have transfer fifth. It is asymmetrical also because the right lateral fifth are wider than left one, and also slightly narrow mouth related to the interpupillary distance. Then frontal examination at smile. We can see the incisal display. It is 75% in this case according to gold proportion of maxillary incisal teeth, and the smile arc is not coincident because it is slightly flat. We can see in the picture also, and the maxillary and mandibular midline is shifted to the right side. Then we have a profile analysis. The soft tissue profile or angle of the facial convexity is increased here. It is 18 degree, and the mean value here is 12 plus or minus 4 degree, so the angle here is increased. Then vertical facial proportion. The upper part is similar to the lower part, so it is 2 cm to 2 cm, and the length of the upper lip is 1/3 of the total lower third of the face. It is 0.7 centimeter of 2 centimeter. Then we have nasolabial angle. The nasolabial angle, the average value here is 20 to 110 degrees. So in this patient it is 110 degrees, so within normal range. Then we have maxillomandibular progressivism. The measure should be distance of subnasal to the vertical line, 6 plus or minus 3 mm. So in this patient it is approximately 3 mm, and Bogonian should be lie on or close to this line, 0 plus or minus 4 mm. So we can see the Bogonian here, it is at same level to the line, so it is within normal range and it is orthognathic. And assessment of the nose. Nasofacial angle or nasal projection, the main value here is 30 to 35 degree, and so we can see the nose here it is slightly prominent because the angle is 38 degree. Then we have nasomental angle. The nasomental angle will range between 120 to 132 degree. So in this patient it is within normal range. It is 122 degrees. Then we have mentocervical angle. Mentocervical angle, it is range between 110 degree and 120 degrees. So in this patient it is 110 degrees, so within normal range also. Then we have submental neck angle. The average in the men it is 126 degree, and in women 121 degrees. So in this patient we can see the angle is decreased because the angle was 110 degrees. Then in E line, if the upper lip is about 4 mm behind this line and lower lip is about 2 mm behind it, so it is normal. But here in this patient it is we have a protrusive upper and lower lip because we can see the lips have no any distance between line and the lip itself, so it is protrusive. Then we have bursal line. Bursal line should be measured from the most prominent point of the upper lip anterior to this line, so it is should be 3 plus or minus 1 mm, and the most prominent point of the lower lip anterior to this line, so lower lip should be 2 plus or minus 1 mm anterior to this line. So in this patient the upper lip approximately 3 or 4, and the lower lip it's approximately 2, so it is within normal range. Then we have S line. If the lip lying behind this line, that means too flat, and if the line anterior to it, that means too prominent. So we can see in this patient the upper and lower lip is prominent, so we can see the upper and lower lip are just slightly prominent. Then Merrifield Z angle, it is average from the 80 plus or minus 9 degrees. So in this patient was measured, it is 74 degrees, so it is within normal range, we can say. Then we have interlabial gap. The interlabial gap, main value here is 2 plus or minus 2 mm. So in this patient was 0, have no gap and within normal range. Then finally in the problem list, we collected all the patient problem in this table, so no need to repeat it again. And this patient has mild skeletal class 2 and class 1 malocclusion because the bite is normal but the upper teeth is slightly overlap to the lower teeth, and the patient has also overrit. That's it, and thank you.